We're pleased to be joined by Dr. Geraldine Oades-Sese, who is project director director of Project C.O.M.B.A.T, which is?
Children Overcoming Military-Based Adversities Together.
So talk about that. By the way, we're here at the Healthcare Foundation in New Jersey doing a series of interviews dealing with services to our veterans. What are the issues that these children are facing?
A lot of mental health issues like anxiety, depression, being that the military member is away or reintegrating back to the home. And so what Project C.O.M.B.A.T is trying to do is to educate the community, particularly the school districts that have teachers, psychologists, social workers, and nurses about military culture, what these children and families experience, and how to help them. I think it's very important that the community help these families. That's not related to the military, themselves, but just a community outreach to support these
Schools
families.
need help in that regard.
Yes.
I mean, they're not set up, per se, to deal with these issues, to understand these issues, and that's why organizations like yours are so important.
Yes.
How do you engage them? Describe it.
First of all, we ask everyone to stand up who has a related family member who's part of the military or friends, and almost 99% of people stand up. So everyone knows someone in the military, but they don't know what they're going through when they serve, when they're deployed, when they're reintegrated with the families. And so this is an opportunity to increase that awareness, to be able to be that support system. Because I think together, that's why together is an important
Talk about
part.
that, because so much of the conversation we had today here at the Healthcare Foundation was with a group of 12 experts. You were one of them, to talk about collaboration, partnership, coming together. Why is it so important that people just don't simply say, well, this is what I do, that's what you do, we do things separately? Why doesn't that work?
Well, primarily because being separate, and I think that's what happens even in academia or in the hospital, that
Silos.
We do work in silos, exactly. And not knowing what each other does, it could be more well integrated, the services, instead of separate. And there could be more focus and more expertise in a particular area instead of being so broad, these services. So,
and plus, excuse me for interrupting, Doctor, but what veterans need very often is multifaceted.
Yes.
They're in different areas, so knowing who else is doing what and the ability to refer or connect is critical.
Exactly, and that partnership and collaboration, then you could help the military member, the veterans, and their families holistically with a wide range of social services, job, employment, to mental health services, and also support systems for the family.
Why is it so difficult? I've asked several of your colleagues this question. I'll ask you, why is it so difficult to get certain veterans, men and women, to reach out for help?
Number one, it's the culture that if you do reach out for help, it's a sign of weakness. Unlike in psychology, one of the things that I say, if you're reaching out, that means you're a very strong person.
As opposed to weak. How, that sounds counterintuitive to some. You reach out, you're strong.
Right.
Wait a minute, no, you're weak because you're saying you need help. But I agree with you. You are strong because?
Exactly. Self-esteem, right? Are you, worthy of that help? That's where it's coming from. So if you feel like you're worthy of help, that's a high self-esteem and you go seek it. Oftentimes,
I don't want to stay like this.
Right. I want to move forward. I want to problem solve, see what my issues are, and move forward. And also, get that job, help my family move forward.
And for veterans, that sense of, I appear weak, I'm coming across as weak, it's exacerbated?
Yes, because the culture itself, that's communicated. So a lot of the veterans, if you speak to them, they'll say that, well, I hesitate to reach out for services because what does that mean for my family? What does it mean for my career? I'm going to look weak. I'm supposed to be strong. That's why
self-sufficient.
Right, self-sufficient. But here's the thing. Communicating that what they're experiencing is normal. So any trauma that they experience during their service, that's normal. It's not a sign of weakness. And I don't know where the military culture, gives you that perception. But that's the human body and the brain reacting to your experience. And you have to normalize it. And I think that's a secret to helping.
What advice would you have for veterans watching right now?
If you're strong, you should reach.
Or you want to be strong.
You want to be strong. You want to move forward. You're resilient. You've already experienced all of these, experience in the military. You have those skills, and you just have to reach out to move forward with your life. There are people that want to help.
Speaking of those people, finally, you're one of them. Why do you do what you do?
My nephew is the reserves. He's actually going through military training. He went through Afghanistan, and it was painful. Even though I was his aunt, him being away and not knowing whether he's going to come back or not, or whether he's not going to come back injured, was very painful for me. So every week I sent him a package. That's for me to cope, and lit a candle for him for me to cope, because I was afraid of what the outcomes will be in his service.
You're helping a lot of people every day. Thank you, Doctor.
You're welcome.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by Summit Medical Group, Delta Dental of New Jersey, the Healthcare Foundation of New Jersey, the New Jersey Re-Entry Corporation, New Jersey Sharing Network, Community Food Bank of New Jersey, and by NJM Insurance Group.